Hello everyone, my name is Varalakshmi. I am a student from final year BPT. Today we are going to learn about breathing exercises and a practical demonstration. What are breathing exercises? Breathing exercises are the ventilative techniques which are administered for both pathologically affected individuals and as well as for normal healthy individuals. What are the goals of these breathing exercises? The goals of breathing exercises include they increase the endurance of the lungs, they increase the lung capacities, they help in removal of the lung secretions, they help to strengthen the diaphragmatic muscles. What are the types of these breathing exercises? The types of breathing exercises include diaphragmatic breathing, partial breathing, nasopharyngeal breathing, and segmental breathing. Again, the segmental breathing exercises are divided into apical breathing exercises, lateral basal expansion exercises, and posterior basal expansion exercises. Now let us see the practical demonstration of breathing exercises. First one, diaphragmatic breathing. To practice the diaphragmatic breathing, concentrate on forward movement of the whole abdominal wall. The another technique combines forward movement of the upper abdominal wall with some lateral movement of the lower lips. The diaphragm is the main muscle used for breathing, but it also plays an important role in breathing exercises. Position. Position of the therapist. Standing beside the patient and facing towards the patient. Position of the patient. Prepare the patient in relaxed and comfortable position in which the gravity assists the diaphragm, such as semi-forward position or slightly elevated sitting position or supine lying position. If you notice any accessory muscle activation, stop him and do relaxation technique. Procedure. Place one hand of the patient on the thorax and another hand of the patient on the abdomen, and ask the patient to breathe slowly and deeply via nose by keeping the shoulder relaxed and upper chest quiet, allowing the abdominal to rise. And now ask him to slowly let all the air out using through mouth. To repeat this for 2 to 4 times. Once they understand the technique, practice diaphragmatic breathing in various positions such as lying position, sitting position, and standing position. Second one, pursed lip breathing. Pursed lip breathing is a technique where you gently press your lips together while breathing out slowly. It is often taught to patients with COPD to help manage shortness of breath. This method improves airflow and helps release trapped air in the lungs. It keeps the airways open longer and slows down the breathing rate. Position. Position of the therapist. Standing beside the patient and facing towards the patient. Position of the patient. Relaxed sitting position. Procedure. Patient in a comfortable position and relaxed sitting position. Abdominal muscle contraction must be avoided. Ask the patient to breathe in slowly and deeply through the nose and then breathe out gently through lightly pursed lips. It can be applied or repeated for 3 to 5 minutes. Third one, glossopharyngeal breathing. This technique helps patients breathe more deeply when their breathing muscles are weak. It is taught to those who struggle with deep breathing. It's mainly for patients who depend on a ventilator due to diaphragm issues from neck injuries or muscle disorders. It can reduce ventilator use. Position. Position of the therapist. Standing beside the patient and facing towards the patient. Position of the patient. Sitting relaxedly on the chair. Procedure. The patient takes several quick breaths of air, about 6 to 10 seconds. While keeping the mouth closed, the patient uses the tongue to push the air back and hold it in the throat. When ready, the patient opens the throat or glottis to force the air into the lungs. This process helps increase the depth of the breathing and improves the patient's ability to take in air. Lastly, segmental breathing. Segmental breathing focuses on a specific part of the lung that needs better airflow. Sometimes, certain areas of the lungs don't get enough air because of issues like stiff chest walls, pain after surgery, collapsed lung sections, chest injuries, pneumonia, or post mastectomy scar. So, it's important to help these areas expand and breathe better. Advantages of segmental breathing: prevent accumulation of pleural fluid and secretions, decreases paradoxical breathing, decreases panic episode, improve chest mobility. Techniques: apical expansion, lateral costal expansion, posterior basal expansion. Apical expansion. This is useful when there is a restricted upper chest movement or incomplete expansion of lung tissue, particularly where there is a apical pneumothorax. Position. Position of the therapist: standing behind the patient. Position of the patient: sitting relaxedly on the chair. Procedure. Pressure is applied below the clavicle using the tips of the fingers. The patient breathes in, expanding the chest forwards and upwards against the pressure of the fingers. Repeat this technique for 2 to 3 times. Lateral costal expansion. This is also called as lateral basal expansion and may be done unilaterally or bilaterally. Position. Position of the therapist: standing beside the patient, facing towards the patient. Position of the patient: sitting relaxedly in the chair. Procedure. Place your hands along the lateral aspect of the lower ribs. Ask the patient to breathe in and breathe out and feel the ribs move downward and inward. As they breathe out, press down gently on the ribs with your palms. Just before they breathe in, give a quick downward and inward stretch to the chest. This helps the muscles to lift the ribs during breathing. Apply light pressure to the lower ribs to help the patient feel their chest expand as they breathe in deeply. When the patient breathes out, gently squeeze the rib cage downward and inward. The patient can also use their hand or a towel to provide some resistance. And this is repeated for 2 to 3 minutes, 2 to 3 times. Posterior basal expansion. This type of breathing exercise is important for patients who had surgery and are lying in bed for a long time. Position. Position of the therapist: standing behind the patient. Position of the patient: have the patient sit and lean forward on a pillow with their hips slightly bent. Procedure. Place your hand on the posterior part of their lower ribs. Follow the same steps as in the lateral costal expansion exercise. Hold for 2 to 3 seconds. Repeat this exercise for 2 to 3 times. Continue for 2 to 3 minutes. This is all about breathing exercises and their demonstration. Thank you.